welcome to another episode of Cancer Tamer. I'm your host, Dr. Charley Ferrer, and of course, we have Debra with us again. I wanted to introduce, and we re-invited Dr. Levitt to talk a little bit more about what was going on. If you recall, Dr. Levitt is the Vice Chairman, Program Director, and Professor at Mount Sinai Hospital here in New York City. He's also the President and Medical Director of Periodic Paralysis Association. We won't have time to talk about that here, but you can look that information up on his website, and we'll have all that information on ours. So please make sure to tune in and get information and go to our website. And so thank you for being with us again.
Thank you for having me.
So one of the things that we wanted, our last segment, we talked a lot about sweet syndrome and how that related to cancer and connections there. So if you haven't seen that show, make sure you do, because it's tons of information. And you can always take it to your doctor and have him also listen to it as well, in case they don't know, because rare sweet syndrome is a rare disorder that develops in cancer and other conditions as well. But today we want to talk about different types of cancers and how those manifest on your skin and in your body. And you're going to tell us a little bit about what those are. And we also, before I forget, we are going to show you some pictures of different manifestations of cancer. So for those viewers that are a little more sensitive, please be careful with what you're looking at. We'll show you some signs of it, which are a little disturbing.
These are for mature audiences.
Well, our show is always for mature audiences, but some of the pictures will be a little bit frightening. So be prepared for that on this show. And of course, you know, you can always close your eyes and just listen to us, because we're great. So why don't we get started on what types of skin cancers there are and how we can identify them or see them in our own bodies.
So the most common kinds of skin cancer are those that are caused by the sun. And so the sun, if you've been to the beach, were a sun worshiper in your youth, and now you're like 50, 60, but you've been to the beach every day when you were 13 through 25, you know, it's 20, 30 years later when those things start to pop out. There's three major kinds. The biggest one that we care about is something called melanoma. And melanoma is, there's melanocytes in the skin. Those are the cells that produce skin pigment. And when those become cancer, they turn into big black blotches. It's actually usually the flat ones that expand and are black, rather than the ones that are raised.
And we have a picture of that, don't we?
Yeah, we should.
We have a couple of pictures of those, some slides that we can show. That, you know.
Is that the one with the three?
The one with the three different pictures on it. The first one. We're having a little technical issue out there.
Well,
so
in any event, melanoma is the one that can spread and metastasize and go to the brain and the lung. So, you know, here you can see on the screen this black patch on the forehead, and it has two colors, maybe even three colors. It's not perfectly round, and this one progressively was getting bigger and bigger over time. But it gets bigger like over years, and so you look in the mirror every day and you don't notice a change. But if you look between 2 years ago and today, you say, wait a minute, that grew. And then it's time to have a biopsy. There's another picture, and this is something where this was on the chest. So this is standard kind of sun-damaged chest of an older fellow. And you see the black, though, in there. And those black aspects are indications that it should get checked out. And this was a melanoma that was reasonably advanced, actually. There's another one. This is very common. These melanomas of the foot that people. You say, how do you let this get that big? Some people get in denial. They know there's something wrong, but they don't go to the doctor. You have to advocate for a family member. If you see them have something like this, push them to go to the doctor. They say that the men, their wives, many times will tell them to go. Oh, they see something on the back, and it's a melanoma, and the wife saved the guy's life.
And is this common too with diabetes?
Not so much with diabetes, but I would say with folks with skin of color, African American folks, Asian folks, Spanish, Latinos, they'll present with melanomas like this.
How does one get it on the foot?
Well, so it's not that they've been putting their foot to the sun, but it's more that there's just genetically the cell decides to tweak out and become cancer. As many times we don't know why cancer happens. Here's a way, as a rule of thumb, to figure out how to check yourself. If you see a mole that has asymmetry, it doesn't match if you draw a line through it, or if the borders aren't a perfect circle, or if there's more than two colors, or if it becomes bigger than a pencil eraser. Those are all things. They're called the A, B, C, D of melanoma, and we add an E for evolving. Those are indications that it should get checked by a dermatologist.
And that's wonderful. So if you see anything like this on your body, it's time to go and get it checked out.
Yeah.
And I know one of the things that you talked about was the fear that people have of getting themselves checked out because of the fact that they don't want to know. They don't want to think that they're sick, or they don't want to look at the fact. I know for myself, I remember vividly of standing in front of my mirror and some of my hair is falling out before I was even diagnosed, and my friend was saying, oh no, well that's just stress. Because I was working, 26-hour days.
Sure.
And so I'm thinking, yeah, this is stressful. But then one time I had just a lot, and I remember just looking at myself in the mirror and going, Charley, you're sick. There's something wrong, it's not just stress. And at that point, it was about 2 weeks later, I got, I went in and saw the doctor, and then I got hit with that. Or I was actually told I needed to wait until I had to wait for a month and a half to be able to see the doctor. And it was more because, and for those of you that don't have health insurance, because I work for myself, so health insurance is a big expense that I wasn't able to carry at that time. So I figured, I told myself, hey, you're not allowed to get sick. My body didn't listen to that.
That worked?
It worked for a couple of years.
You're going to have to tell me how you did the 26-hour day. I'm really curious about the 26-hour day.
My 26-hour days are long, but I can stretch it out. But it is that point. There's a point where, yes, it's fear, but you can't allow that to take your life away. You have to go in, or, you also mentioned the fact that, it's sometimes the person's wife or the person's husband or the person's lover who will say, honey, you need to go and get this checked out.
Or hairdresser.
Or hairdresser. But you need to go and get this checked out because of the fact that it's getting worse. And one of the things you also mentioned was the fact that if you're looking at it, you don't notice it. Just like if you have children, you don't notice how much they're growing. It takes somebody from, haven't seen them in a couple of months to say, oh my gosh, you've gotten so big. So you don't notice things as they're occurring.
Listen, that happens with breast cancer too. There's women who have just really intense growths and expansion of their breast, and it's an obvious cancer. And they just go on as if it didn't exist. And it's a funny psychology that happens with humans. But if you're watching and you have something like that, hopefully this motivates you to go and get checked.
Yeah, and we do have a picture of some of the cancers of the breast. There's one with a rash that it looks like a rash almost. And it's actually, you had mentioned that it was actually
After mastectomy.
Yes, right
so,
here.
So you see there's one breast, so the patient had a mastectomy, and this rash developed over many months actually, but it was confused with shingles, it was confused with other things, and they come in and it actually is just, all of those red bumps are breast cancer that spread directly from kind of inside the chest wall to the skin. It doesn't make the best prognosis, unfortunately, but at least you know what's going on.
Is it a skin-eating cancer?
Not a skin-eating. It's not there's no real. The flesh-eating things or the sweets that we talked about would be flesh-eating, and bacteria can be flesh-eating. These are just, it's cancer that goes to the skin.
So it was in and it came out.
Yeah.
That's how it goes.
It just means that obviously whatever treatment happened didn't work.
So is it only for women who have metastatic?
Yeah, so that would be
Metastatic cancer.
metastatic breast cancer,
okay.
yeah. After mastectomy, which is taking off the breast. So
okay,
you
I
have
see what you're
metastasis, which is spread, of mastectomy, which is removal of the breast.
Right. Now, these things, are you predisposed to get these kind of cancers? Let's say melanoma.
Well, melanoma, so you're predisposed in two ways. One, with extensive sun exposure, so please use SPF, even 70 or 100. They say if you use SPF 15, it's enough, but most people don't apply it thickly enough. So you have to apply it really thickly and like every 2 hours. A compromise is to use SPF, 100. Still try to apply it as much as possible. The second is some people are genetically predisposed. So if dad has a melanoma, well, his father, his brothers and sisters, and his children, all those first-degree relatives should get checked for melanoma.
So is that a genetic test, or is it simple?
Well, so no, that's as simple as going to the dermatologist, getting naked the whole way. They have to look everywhere, under the breast, in the butt crack, everywhere. Don't be bashful, and because you have skin everywhere, and you get checked. For folks who have like 2 melanomas, or melanoma and then pancreatic cancer, there are some special gene tests that you can see a geneticist for that they can test for. That's more rare, but still.
And your genetic testing is basically very easy. They're just taking a bit of your blood
test.
and that's
Right.
it, and it's
Doesn't
over.
hurt.
That's right.
And one thing that I want to point out, though, with the genetic testing, just because you may turn out to be positive does not mean that you're going to actually get the disease. So I've heard of a lot of women who will say, oh, well, my BRCA1 and my BRCA2 came back positive, so that means I'm going to get breast cancer and I have to hurry up and get a mastectomy, and that's not true. The truth is that you may be more susceptible, more susceptible to getting breast cancer or getting any other kind of cancer that's in that gene pool, but it doesn't mean you're gonna 100%.
That's right, but
you have to be more careful.
Yeah, it tells you to see the dermatologist every 3 or 6 months instead of every year, and it tells you to stay the heck out of the sun. Absolutely no holds barred. Just don't go in the sun. Pop a vitamin D pill to get your vitamin D, but you have to modify your behavior if you're predisposed to those things.
And on the same note, too, with genetic testing, and we touched on the BRCA gene. Now, my BRCA test was negative, and I had cancer. Now, I always assumed you only get cancer if you're positive. So it's always good to get that test. And when you talked about the sun and the suntan lotion, is it necessary to have a face suntan lotion? Because there are 2 different kinds.
For
or
sure.
Can you use the body?
Listen,
on the face
the ingredients are the same. That's a marketing gimmick. If you want to prevent wrinkles on your face, you heavily put sunscreen so you don't get wrinkles on the face. But the same ingredients that are for the body or for the face, maybe they make the face a little more vanishing, so it's not goopy, so you can put makeup after, something like that. But
and what about the makeups that have? They say they have the SPF.
Yeah,
in
those
them.
are great.
Those good?
Yes, those are good. Those are good.
Okay. Because we also, one of the things that we were concerned with was you hear a lot about all the chemicals that are in makeup.
Sure.
And so, and I figure that's a whole nother topic.
Yeah.
But the fact that being conscientious about the makeup that you're using. Don't
be afraid of chemicals in the makeup. I think that a lot of people want to say that chemicals in the makeup cause cancer. The FDA regulates a lot of the products that are on the market, and they wouldn't let frankly carcinogenic chemicals get in the supply for the population. So if it's on the market and if it's a reputable brand, then it's safe to use, and you should definitely seek to use things with SPF, sun protection factor.
I noticed that the Chinese people, the Asians, that they use an umbrella. And it's amazing because when you do look at their skin is beautiful.
That's right.
It's flawless.
Yeah.
They know something that we didn't know, and I'm glad they brought it to America.
And if you look at it from the perspective, I mean, when we talk about different cultures that are doing that, back in the 1800s, the woman walked around with her little parasol so she wouldn't, she wouldn't get hit with the sun.
That's right.
And so we need to do that as well. We need to consider that. And there's wonderful ones. I actually went out and bought myself a little parasol, which I think it's cute.
Oh, I love
What I would like to address is
Yes.
there are two other kinds of common skin cancer. There's basal cell cancer and squamous cell cancer. And these will present as like scaly kind of bumps on sun-exposed areas like the nose, the cheeks, the forehead, the scalp for a bald guy, or like the tops of the hands. And if you have like an ulcer that's new, that grows on the face, that's been there for 2 years, 3 years, that's an indication to get it removed. After age like 35 or so, you shouldn't be getting new bumps. If you're getting new bumps, you have to check those out.
Are you meaning bumps like pimples? Or,
Well, not pimples, but like,
bumps
you know,
underneath,
like
skin?
raised skin, specifically that bleeds recurrently. You know, that's not a good sign.
Okay.
Yeah.
And any other places in their body if they get ulcers? And by ulcers, we mean like a cyst or...
Well, by ulcer, I mean like skin breakdown where it
Okay.
kind of bleeds or has a scab. Yeah.
Okay.
So like, let's say brown spots that people get over the years, because you said it takes 30, 40
Well,
years.
yeah.
Should they be aware of it and also look to see if it's raised?
You
or
look to see if
scaly?
it's changed. You got to look at that A, B, C, D thing, and if there are irregularities in that respect, you check them out. Listen, the majority of lesions on skin are from age or these thing called seborrheic keratoses, these stuck-on growths that many people have. But if they change, if they're really black, if they're more black, the ugly duckling sign, if it's more black than all your other moles, then you have to raise a red flag and check it out.
Okay. There's two other pictures that I wanted to show about leukemia and how that would manifest and how that would look on the skin. And it looks like blood blisters almost on the arm, like this
So
one.
this is interesting. So this is actually not a blister. It's very solid. It's filled with tissue. And if you see the other picture, you could see it's raised on the skin. It's the same picture from a different angle. And that is how leukemia cutis, or when leukemia is a blood cancer and it lands in the skin and grows there, that's how it looks like. It's very rare. It's an indication that like your chemotherapy isn't working. And sometimes it's an indication that your chemotherapy is working if it's fading away as you're getting chemotherapy. So you wouldn't want to welcome it on your skin, but if it's there, you can spin a positive note that it might be an indication that if I take chemotherapy and it shrinks, that I know I'm getting better.
So then, is that an indication with that kind of a rash that you could have leukemia? And then your doctor, the dermatologist, has to really know what's going on. That's the
Yeah, I
fine
mean,
line
listen,
that
if you present with that as your first sign of cancer, I mean, you have frank leukemia, that's a problem.
Right.
Usually that happens after you know about the diagnosis of leukemia, you've been under treatment, and then it's like 2 years later you get this thing on your skin and you're like, oh boy. It's that kind of a thing.
Does it depend what kind of chemo? I mean, what kind of leukemia? I mean, because I've learned there's so many forms of leukemia.
It's not necessarily. I mean, they all can kind of do that.
Okay,
Yeah.
thank you.
Yeah. So as you can see, there are so many kinds of cancers out there that it's hard to know which one, and so it's always important and always essential for you to go to check with your doctor, to be seen by your physician, not only your primary doctor, but also ask for a dermatologist's evaluation and a referral. One of the things that I found, and I'm sure Debra too, you found this, is every time that we try to say, hey, I need a referral for this or I want this, we'll always be told, well, your insurance isn't going to pay for this or your insurance isn't going to pay for that. And one of the major things or the advice that I can give is you ask your insurance company if they will refer you, if this is necessary. As long as your doctor says this is necessary and it's a consideration, then most insurance companies will pay for it, but you do need that referral. And I know some of the tests that I've been given, it is a mental health issue as well, because I've become, especially since I had so many rare reactions and complications, it became the one piece of they had to rule things out or they just had to keep me sane. And so referring me to other physicians as well.
I will say that there is a crisis in America, specifically with a lack of dermatologists, and to get in to see dermatologists sometimes can take as long as like 3 to 6 months. And if you have a cancer, that you think is growing, you need to get in way sooner than 6 months. And I'm not really sure how to navigate that except to, have your physician call the dermatologist and say, hey, can you, check this guy out today as a favor? Because most of the complaints aren't of cancer, they're of acne, they're of stuff that's important, but not that important. So you have to advocate for yourself there. And then sometimes there are like, resident clinics where there are student doctors. That's easier to get in. They may offer same-day appointments. And if it's just to look at one thing to get a biopsy, maybe even for that one time, you can do that before you get looped into like a more steady system.
Well, I think it was amazing that your doctor at one point said, okay, let me call the dermatologist.
Right, and she did,
That's
like you said, she turned around and called your office.
So how soon did you get in?
I got in within a week.
That's
within a week, and she said it was a favor you were doing for her. Because when we found out, and she said, okay, well, let's send you to the dermatologist because I don't know what's going on. And then at that point she says, oh, well, it's going to take 3 to 4 weeks for you to get in. And I'm going, I can't wait 3 to 4 weeks.
Yeah, no.
Because that was so horrible.
It's a problem because if you think about it, right, if most dermatologists, they're seeing patients from like 7 a.m., some of them, to like 7 p.m. And every 10 minutes they're seeing a patient. And it's not to make more money, but it's just there's so much demand. So, and if I don't, what's the alternative? I don't see you and you die of the melanoma, or I see you for 10 minutes, I don't give you quite the same amount of time, but I fixed your melanoma. So like, how do you add another patient in that? So now you're going from 7 p.m. to 7:10 p.m. Like, when do you go home? So I mean, it's not just that the dermatologists are being she and they don't want to, see you. And it's a crisis. It's a crisis.
It is, and I know that when I got into your service, they're like, oh, he's not taking new patients. You can't come back after this. But I'm going, okay, well, he already knows me, so just squeeze me in there and give me 10 minutes.
No. Listen, I also have to give instructions. Otherwise, people will keep coming, and I'll take on new patients, and I won't have time for the follow-up. So it'll be unsafe. I'll start a treatment plan, and then they won't be able to follow up because there's just physically no time in the day unless you make the 26-hour rule.
I was just going to say, why don't you do the 26-hour day?
But let me ask you. So when you got that call, you knew that it was something very important.
Yeah, and I mean, listen. When another doctor says, "Hey, this is out of my league," you oblige right away, and you hope that, like, when I have a patient that needs a plastic surgery, for example, they oblige sometimes the same day. And so doctors in a system have that collegiality, and that's why you ask your doctor to advocate for you, to pick up the phone and just make it happen.
Yeah. And that's really important because I know when I was looking you up, one of the comments that I was given was that you were very good at your job and you were also an academic, so you were also researching even more about the different conditions that were out there.
Right.
And then our big joke was you had your interns coming in with you. And
right.
She told me about that.
But we won't discuss that here on TV.
But it's good because you're teaching, you're up on the newest procedures that are being done and the new cancers that come out all the time. If you're not teaching or it's not a teaching hospital, then how can you?
Well, how will the next generation? How will the next generation learn about how to treat? And what happens if I get hit by a bus tomorrow? I don't know. Well,
I'll be really mad at you.
We need to as experienced clinicians, we need to download that information to the next generation, and the patients play a big part of that by saying yes, it's okay to have them in. It's okay to show even the private parts, but just so that people can learn.
Right. Yeah, because I've met a lot of your interns and
thank you.
And they're wonderful, and I joke with them a lot. One of the things before we end, because we're almost at the end of our show, and I do want to touch again, I know we talked about it a little bit before, but it is the fear factor. There is such a huge fear factor when we get diagnosed. And I know personally, and I've talked to others, and I know the same thing was with Debra, was the fact that, you hear that cancer word. It took me 2 months before I could say the cancer word without crying or without, needing time to get myself under control so that I wasn't so terrified. But I think that even though you're scared, even though, you think, oh my gosh, there's something wrong, I don't want to know. But that piece of I don't want to know is what really screws you up, because the I don't want to know lasted for 6 months, a year. Well, maybe you could have gotten treated much sooner and it wouldn't have gotten to such
Absolutely,
a big complication.
especially with skin cancer. With skin cancer, if you cut the thing out when it just starts, it's a cure. 100% cure, will never come back. If you wait until it's that big black thing on the foot, even if you cut off the foot at the knee, it may have spread already. So a pound of prevention is worth an ounce of cure, or something like that. Yeah.
So when you have the skin cancer and you've waited too long, you're saying it can go into the bloodstream or lymph nodes
absolutely.
or everywhere,
And then you're finished. Yep.
Okay.
And then that's where you talk about metastasize and about it going into your lymph nodes and about it going, your breast cancer spread to your knees because your cells
I will
travel.
say, as a ray of hope, there are these new biologic agents which are very targeted against making the immune system attack the cancer. Our immune system at rest is not attacking anything, but there's ways of making it lift the gate and let the immune system tiger out to kill the cancer. Now, it also kills other things in your body, but those things make things like melanoma, which once was unheard of to have a cure, to have remissions. It's not in a lot of people, but it's in a bunch of people. And same for other kinds of cancers. So we're in a new age, and we're progressing rapidly for this. So it's a very hopeful time for cancer folks, even if you miss the boat. But try not to miss the boat if you can.
Yeah. And missing that boat means you're not advocating for yourself, which is something that we here at Cancer Tamer talk very much about. And we love to be out here and advocate for you. And we love the fact that you send us your questions, you send us your comments, and you advocate for us as well by spreading the word, by letting us know that we're here and we're bringing you the information, and you help us get the word out. You also give us ideas on what to research, because Debra's always getting your ideas and going, oh yeah, we'll look for that. Even our latest one is sea cucumbers that we're going to be talking about and doing a show on that. And it's
exciting.
Different ways of dealing with cancer. So there's so much information out there. And so we want you to always spread the word and get information for yourself and do advocacy for yourself. Feel free to contact us at www.cancertamer.org to get more information, and you can also view this video there as well as on YouTube and other places. We now have a series not only in Staten Island, New York, but also in Manhattan. You can get the information for those shows on times and channels on our website. And if you are out in the boondocks, if you're out in another part of Manhattan or New York City or New York State or New Jersey that you're seeing this, think about sponsoring us in your area, and we can take the show there.
Yeah, we would love to be there.
We'd love to be there. So thank you for watching. I'm Dr. Charley Ferrer. Our wonderful guest today is Dr. Jacob Levitt from Mount Sinai, and of course...
And I'm Debra from Did You Know, and I thank you so much. It was such a pleasure to sit and talk and learn a lot more.
Thank you so much for having me, guys.
We really appreciate it.
That's great.
Thank you so much.